Good morning. This is Dr. Charishma from the Department of Pediatric and Preventive Dentistry, SRM Dental College. This video is about band and loop space maintainer. What is it and how do we fabricate it? Coming to the space maintenance is the process of maintaining a space in the given arch which is previously occupied by the tooth or a group of teeth. Space maintainer is an appliance. It's a fixed or removable appliance which is designed to preserve the space which is created by the premature loss of a primary tooth or a group of tooth. So space maintenance is the process and space maintainer is the appliance. There are many kinds of space maintainers which are available. In that there are fixed appliances as well as in removable appliances. In fixed appliances, band and loop appliance comes the first. Then there are many other fixed appliances, space maintainers which are there, like lingual arch space maintainer, transpalatal arch, transpalatal arch, distal shoe space maintainer. Every appliance has its own application, indication, and use. So this video will exclusively will see about what is band and loop space maintainer and how are we going to fabricate it. So, what is band and loop space maintainer? It's a unilateral, non-functional, passive, fixed appliance which is indicated for space maintenance in the posterior segments when there is a loss of single tooth. It's a unilateral appliance. Okay, it helps to maintain the space in one side. Then it's non-functional. We are not going to replace the teeth. We are only going to maintain the space here. That's why it is non-functional, and it is passive appliance. It's not active appliance. This appliance is not going to act any forces or continuously acting some pressure. It's a passive appliance. It's just going to stay where it is kept and how it is kept, and it's a fixed appliance. When do we give this band and loop space maintainer? The first indication is early loss of first primary molars in primary dentition. When there is loss of first primary molar, with the help of the second primary molar, you will take the support and then will give the band and loop space maintainer to maintain the space. And when there is bilateral loss of single primary molar, before the eruption of the permanent incisors, we'll go for bilateral two band and loop space maintainers. And when there is when second primary molar is lost, which is after the eruption of the first permanent molar, then you can take the support of first permanent molar to band and give a band and loop space maintainer. So these are the indications of band and loop space maintainer. The advantages of band and loop space maintainer is a very effective space maintainer for unilateral loss of single tooth in buccal segments. It's economical to make and construct. There's very little chair side time which is required. If you use the preformed bands, even that is more reduced, and it can adjust easily to accommodate the changing dentition. But there are few disadvantages also with this appliance. The first and very important disadvantage is there is a decalcification under bands, and there are certain methods to prevent this disadvantage also. We can do the fluoride application, scaling, and all before looting the appliance, and periodic maintenance and recall review is needed. Even then, sometimes this is unavoidable, and this doesn't prevent continuing eruption of the opposing teeth. Okay, so when band and loop spacement, there is a chance for the over eruption of the opposing teeth, and it does not restore the chewing function and limited to maintenance of the single tooth loss. You cannot extend the loop too much for two or more teeth. So these are the advantages and disadvantages. Then how do we fabricate? What are the pliers or what are the instruments which are used for the fabrication of the band and loop space maintainer? So these are the different pliers which are used. Hoe plier, strike hoe and curved hoe, band pusher, band seater for banding, band pinching pliers, and band remover. These are the different pliers, and there are certain other. So coming to we need bands, right, for banding or band material to do the banding procedure. So there are many types of bands which are available. So there are different thicknesses of bands are also which is available. That is zero point 0.3 in 0.03 inch or 0.004 inch, 0.005 inch, and usually for deciduous molars we do use 0.005 inch, and for permanent molars we use 0.006 inch. For anterior teeth very rarely we do band. For bicuspids also very rarely we do band. But if you are doing banding for a canine or something, we go for 0.004 inch or 3 inch. Okay, and nowadays there are so many types of preformed bands which are available. Okay, stainless steel bands, chrome alloy bands, bands with bonded buccal tubes, bands without bonded buccal tubes. So there are many types of bands which are available in the market, which can ready-madely we can just use and select that particular size for banding. Yes, but we also have to know how the banding is done. That's very important. So these are all the other few things which are required: a micromotor and band polishing burrs. For soldering and welding the loop, you need a spot welder, and then soldering the flux, silver solder in the flux. So how do you do the banding? So first, the most in your like the initial step is like you have to place the separators independently for the ease of the band adaptation. On mesial side and distal side, we have to place the separators. Leave it for 20 minutes or something if the contacts are very tight. If the contacts are not so tight, you can directly go for the banding also. Then you have to select the band material. The band, it has two sides. One is dull side and the other is shiny side. Dull side is to be placed towards the teeth and shiny side to face outwards. Why do we place dull side towards the teeth? Because that helps in the retention of the cement and mechanical retention. It helps in the additional mechanical retention. And the shiny side, if it is outside, it prevents the food lodgement. It prevents that the food and all is not getting accumulated over the band. So it prevents in that. And then so first, what we have to do, take some 2 inches of the band material, okay, and the loop is made and the spot welded, okay. So we'll get that one loop. Then you can place the loop over the tooth, try to adapt it, okay. And then first trial pinching is done with the hoe pliers. Here you can see it in the third picture, okay. With the hoe plier, we are closely adapting the band. We are pulling the bands together, okay. So the upper molar is usually pulled towards the palisade and lower molars will pull towards the lingual side. Once that the pulling is done, the seam of the upper band, it should be kept at the mesiolingual line angle. For lower band, it should be kept at the mesiobuccal line angle. So seam should be placed opposite the cusp and not the groove. Okay, so now you can completely squeeze the band with the hoe plier, and the new closer seam is again spot welded. Okay, and then we can use band pinching pliers to tightly adapt the pin. You can pinch the band, and then some festooning should be done. Festooning is like it's a S shaped thing. Okay, you'll have buccal U shaped and proximal V shape, reverse U shape. The festooning should be done, and trimming can be done with the help of the micromotor and pliers. In the last picture, you can see how the band is ready. So the final banding will be done after the festooning and trimming, and this is how the band should be ideally. So lingually, it just below the developmental groove it should be, and buccal it should not interfere with the occlusion. And cervical extension should be 1 mm below the gingival margin. Okay, it should not interfere with the occlusion. And lingually also it should be 1 mm below. Proximally, if you see, it should be 1 mm below the marginal ridges, and gingivally 1 mm it should extend below the gingival margin. Then after once the banding is done, you will take the impression, okay, and you will transfer the band into the impression, and then the band should be secured and the cast is poured. So you can see how they have secured the band by using bobby pins, and then they have poured the cast. After this, you can remove the bobby pins or you can bend them to prevent self injury and all. Okay, once the banding is stabilized, then you have to construct the loop. The wire loop should be made. The arms of the loop, they should be placed in the junction of the middle and the cervical third at the same time without interfering the occlusion. So the loop, okay, the loop contour, it should be similar to the gingiva, and it should be placed as close as possible to the gingival contour. The final width of the loop should be wide enough to allow the eruption of the premolar, and the loop should be placed just above the contact area of the supporting tooth in a passive manner. So in the mesial side, if you take, the loop should be contacting the just above the contact area, the loop should be placed. And on the banding, on the band, the loop arms, they should be placed in the junction of the middle and the cervical third, so that they won't interfere with the occlusion. And the loop contour, it should be like 1 mm away from the gingiva. Okay, and it should follow the contour of the gingiva. That is how the loop should be. Once you have construct the loop, so this is how the loop first the initial loop fabrication should be done, and then you can curve gingival contour can be done with the help of the three prong plier. Okay, and then marginal adaptation should be done. So once the loop is done, you have to stabilize the loop. Okay, stabilize the wire in position. So you can just place some wax on the cast and then place the wire. Okay, wire and then stabilize it. Once you have stabilized, then you can mix some plaster and keep on the mesial side, mesial tooth, so that it will get secured. Okay, so once your thick mix should be applied so that it will set fast. And once the plaster is set and you have secured the loop, then you should remove the excess plaster on the shoulder, nearing the shoulder area and all. You have to remove the plaster. Okay, inside of the bands, any plaster, all everything you should remove. Then shoulder seal flux can be fluxer should be placed. Application of the flux should be done in the same way like how you need a shoulder to flow. Okay, depending on the flux, the application of flux only the shoulder will flow. Then you will do the soldering. So how the solder should be once it's done. Okay, it should encircles the wire and it should extend the full length of the contact area between the wire and the band. The occlusal and the gingival margins of the band should be free of solder. And the surface of the solder joint should be free of pitting and voids. There should be no voids. And the wire mesial to the solder joints should not be annealed. Okay, and then you can do the polishing you will do usually with a heatless stone to reduce the distal length of the wire to form the smooth curve continuous with the band. The ideal solder joint is concave. If a minimum of solder have been used, the joints will be concave, and solder will not extend to the margins of the band. So appliance should be finally polished, cleaned and dried. So there are various modifications of band and loop space maintenance. First thing is crown and loop, where you will place a crown if the adjacent tooth is compromised. You will do the pulvectomy in the crown, and the loop is directly soldered over the crown. And crown band and loop, where you will do the banding over the crown and then you will solder the loop. And there are a few other modifications also like reverse band and loop, where you will do the banding on the mesial tooth. Okay, and reverse crown and loop band and bar main appliance. The single arm appliance which is shown in here is the main appliance. There is no buccal arm, only the lingual arm will be present. And band with tube and loop. This is a nickel, Dr. Nickel 2016 appliance. This is according the case report published. So you can see how the band and loop are modified. Both the tooth are banded and then a V-shaped appliance. This is an active appliance. It can be used as a space regainer as well. Right? So there are many other NIMS modification or a modified loop bands with modified loops, and there are many modifications which have come. So this is all about the band and loop space maintainer. Thank you everyone.